Okay, welcome back to our last session. It is my privilege to introduce Kathy Greenlee. She served for 7 years as the Assistant Secretary for Aging at the U.S. Department of Health and Human Services in Washington, D.C. During her tenure, Kathy provided national leadership on the realities and prevalence of elder abuse. Her work included the development of a Home for Adult Protective Service programs at the Administration on Aging. Since leaving Washington, D.C., she's continued her work on elder abuse prevention and response at the national and regional levels. Kathy recently launched a consulting venture, Greenlee Global LLC. Her goal is to engage regional and national partners to advance reforms aimed at improving people's lives with a focus on health, independence, and security. Prior to going to Washington, D.C., she served for 18 years in Kansas state government, including her final position as Kansas Secretary of Aging. During her many, many years of public service, Kathy developed expertise in the areas of aging, long-term care, disability, elder abuse, healthcare and community services innovation, and LGBT health. She serves on several national boards and continues to work on improving the lives of older adults and persons with disabilities. Kathy's a University of Kansas graduate, having received a BS in Business Administration and a JD from the School of Law. Help me to welcome Kathy Greenlee.
I think you should get a half an hour of CLE just for listening to the bio. So I would rather have a lavalier and roam around. So I would really like to be engaged with you all, but I'm kind of stuck right here, and I'm short, so we'll work on it. Do you have body parts that are asleep at this point? I mean, it's been a long day. It has been, I graduated from KU Law School 31 years ago. And when I moved to Washington a decade ago, I put my law license on inactive status. So it's been a long time since I sat through a whole day of CLE, but I do remember how that last hour feels. So I would really like to engage with you all and just talk. I don't like PowerPoint slides because I forget what I'm supposed to do. It's like, oh, I already talked about, because I just like to talk. I have some things I want to say, but the slides won't be helpful. I know we've got people watching and listening remote. I would love it if they would send questions or comments or criticisms. I'm open so that we can just be engaged this last hour. So I have a Nebraska story for you. I have been your neighbor most of my life. I grew up near Wichita, small town. When I graduated high school, I moved to Lawrence to go to the University of Kansas. I lived in Lawrence for 30 years. And had never lived outside of the state before I moved to Washington. And I tell people that really hadn't been my goal, that's just what had happened. I'd worked for 2 decades in Topeka and state government. I had wonderful opportunities. There was a point in life when I actually had traditional legal jobs, assistant attorney general, general counsel at the insurance department. But when I left 10 years ago, I'd never been gone. So I got homesick, naturally. I used to get homesick at camp. And I went the end of June. And by that fall, so about 10 years ago, in the fall of 2009, I was asked to come speak at a meeting in Denver at Grantmakers in Aging. So I flew from DC to Denver on the window seat. And I got almost there, and I looked down, and I was over Nebraska. And it was like, oh, it's Nebraska. It's almost home. So you're kind of close. We kind of feel like kin here in the Midwest. And I never forgot when I was there that I was a Midwesterner. And people always experienced me. First of all, I go by my first name and I hug everybody. And so that was always a little off-putting. I'm very direct. And in one conference program, because I've done thousands of public speeches, they put straight-talking Kathy Greenlee in the program because it's just sort of the Midwestern background. So I am glad to be here. There's some things I want to do, but really, I wanted to meet you. I wanted to come to Nebraska and meet you because of what you're doing, and thank you for what you're doing. I know we have lawyers, and we have 70 attorneys around, adult protective services workers. I just want to say thank you. I want to talk about the Midwest. I would like to do this with our time, and you cannot get me off topic. I've talked about this in every direction you could think of in terms of elder abuse. So you're welcome to engage and ask me questions. I want to talk a little bit about the history of adult protective services and provide some explanation, I think, for some of the challenges that we still have. I want to share with you things that are on my mind, and I want to challenge you in your thinking. And I would be glad to raise things that you disagree with, but I want to share sort of Kathy's current thinking after spending a lot of time working and learning about this issue and ask us, are we doing what we want to be doing? And then I want to talk about the Midwest. There are many, many people around the country working on these issues. The ones that get the most notice are on the coasts. And I would like to talk about what we do here best and how we can come together as a region and talk about what we bring. We should own the issue of elder abuse in rural America. We'll have to call Maine, because Maine's very active in this too. But I think there's some ways that we can provide leadership, and I think our voice is needed. So that's really what I want to do. And I have these notes, and we'll just kind of launch in. So I want to talk about adult protective services as we start. And think about, have any of you done domestic violence or sexual assault work, child abuse work? I mean, there are many of us who've done elder abuse work who have come a pathway from one of these other fields. Mine was doing domestic violence work. I was trained in 1984 as a volunteer at the Battered Women's Shelter in Lawrence, and for a brief moment, like a year, ran the statewide Domestic Violence and Sexual Assault Coalition. So, can you imagine domestic violence work without being informed by formerly battered women? It really was the formerly battered women that started this movement. And it went through a cycle. I mean, I started doing this work, it really kind of started in the 70s, as many of these other social movements started in this country. But it was really formerly battered women that started. And as the work progressed and evolved, there was issues within the work about how you professionalize it and whether social workers should be credentialed or whether formerly battered women are sufficient as peers. But the foundation was always formerly battered women. You can say the same thing about the work that we do with sexual assault survivors. You were rape victim survivors, because we didn't broaden the language yet. Rape victim survivors that really started challenging law enforcement and the rest of us, that this work has always been foundational. One of the biggest differences in working on elder abuse is it does not come that pathway. This is not work that is brought to us by the people who've lived through it. And I think I want to come back and ask some questions about kind of how we've structured the work and come back to that point. Because I wonder if there's things we've designed that I don't know if older people would have done it this way. And I think it's still hard for all of us to figure out how to bring older victims and survivors. I mean, we need to move our language. I have talked about this, like I said, a ton. And I had a young assistant working with me who had heard me, fortunately or unfortunately for her, hundreds of times. And she said, Kathy, why are you always talking about victims instead of survivors? I said, because the survivors are not doing the work. I mean, they're the ones who would hold us accountable in a better way. And talking about survivors and resilience and trauma-informed care is oddly new, sadly new. But this work is not based on that. It's based on a lot of the rest of us who feel this as a heart issue, as I do. But I think it's always important to kind of go back and realize it's not the same. And it did not come from being informed. So do you know, or at least I'm going to tell you, the history of how we came up with adult protective services in this country and how different that is from child protective services. I will just take this great leap of faith and assume that in Nebraska that the child protective services have more funding and are more and are different, more robust. There is a reason for that. And it goes back to the 60s and 70s at the federal level, where the federal government and Congress decided that we needed to provide an infrastructure to states to set up child protective services programs. So they built it. Passed a big law in the 70s, which they might can't remember right now, and started to create a national home at the Administration for Children and Families for child protective services. They provided dedicated funding to the states for child protective services, technical assistance. And I know we've got lawyers and APS people here, government people here. If the federal government's giving you money, right behind it is the regs, or the regs. Here, comply. You have our money, we want you to do it this way. So the federal government at least had a hand in starting to determine some uniformity. How do you categorize cases and close cases, and what should you do? And by the way, we'd like to have some data. And we would like to have a TA center to work. We built all of this for child protective services and never built it at all at the federal level. for adult protective services. We didn't build it. There were some pieces of legislation that didn't pass. It wasn't that no one knew, but we never built that system. And one of the hard parts we all have, I think, as allies with adult protective services is the criticism that people have about the lack of robust response. And there are other criticisms of APS, like why can't they swoop people away, those kinds of things. But in terms of sufficiency of response, part of the frustration is that the public and law enforcement, and even those of us in the work, we continue to mistakenly think that adult protective services is child protective services with an A. And it's not. I think the fact that they sound similar is a problem to overcome, because they're not similar at all. There is still no dedicated federal funding stream for adult protective services anywhere. Federal government doesn't send you money, Kansas, no one. No state gets dedicated money for adult protective services. And as someone who spent 25 years in the executive branch, and so I've had this sort of healthy, tenuous relationship with the legislative branch, there's a benefit at some point to post-audit. And I've called legislators before and said, could you audit my department? Could you kind of do an analysis of the difference between what our investments are so we can provide a level platform and do some education? People expect the same thing. We never built it. The only federal money that goes to a state adult protective services program is the discretion of the state with regard to how you spend your social services block grant. So there is federal money there. So it's very important to say there's no dedicated federal money. But it also means it's a mishmash around the countries. When I first started doing this work, the amount was around $200 million annually, collectively coming out of SSBG, but it funds a whole lot of other programs. And at the federal level, the block grant is always in some peril in Congress, because there's that kind of teeter-totter problem of Congress often wanting to give states flexibility, but then being frustrated when you don't all do it the same way and they don't know what the outcomes are. So SSBG and some of the big block grants, community services block grants and others can really be kind of at risk. So there's no federal dollars or federal office or federal role. I went to Sacramento about 5 years ago. The social services system in California is still a county-based system. So they have 58 adult protective services programs in the state of California. They had never met with a federal official to talk about adult protective services. We simply had no relationship. And they were having huge problems with interoperability. And they told the story about a person who they had an open case on in Los Angeles City. I think it was a woman living with a son or someone. Anyway, she left, and they couldn't find her. They didn't know she'd gone to visit a relative, and they didn't know where she'd gone. And they started calling other counties. Had to call Los Angeles County, do you have so-and-so? So they were really struggling with lack of interoperability. So the fact that these are not similar continues to be something that we have to educate people about and say, this is you're not going to get the same response. We never built the same thing. The Social Security Administration is the one that gave the nod about the social services block grant. They finally sent guidance to the states and say, we think it would be fine if you established a protective services program for adults. So every state has both, kind of the older population and a younger population that gets described in different ways of vulnerability. And it's always a bit dicey with the disability community in terms of how that's described. But there's always two populations in every state. But it's completely different. So one of the challenges that I had on working this issue at the federal level and trying to get appropriations with Congress is that Congress took the position that we're not going to fund anything new. Well, what do you do with that? It's like nothing new. And you can't really pretend that this is an add-on. And it's like, okay, we can't not build this. And the advice I started to give to the advocates and the stakeholders kind of working as you often need to, sort of the inside-outside strategy is, you cannot describe this as underfunded. That's true. But you cannot distinguish yourself in a line of underfunded programs. It's a very long line. And it's easy for anybody in the executive branch or legislative branch to say, well, get in line. Every Medicaid provider is already ahead of you in line. So you can't say it's underfunded. It's a different thing to start describing, we didn't build it. We've got an aging population in this country and we never built the infrastructure. And that finally started to get a little tiny bit of traction, meaning $10 million at the federal level to build the National Adult Maltreatment Reporting System, NAMERS, which we can now collect data from all of the states, start trying to figure out what's going on, and some demonstration grants that I was able to get at ACO. But it took a lot of work by me, by the external stakeholders, by the support of the Secretary of HHS, the support of the White House, to get there. And the biggest hurdle was we're not doing anything new. And we continue to have to overcome this sense that it's already there. Surely it's already there. Y'all are a lot like Adult Protective Services, and it's not. So what we have is every state being different. And it was interesting to hear California talk about that in some counties they never confirmed a case. And they got to comparing notes about how many files should you have open and what should you do. No sense of uniformity. And because we don't give states at the federal level money, there's not a way to demand compliance. So what we produced at Administration for Community Living were voluntary national guidelines. And I encourage you to use those as you would the lever of regulation and say to anybody who may need to be sort of in your camp to work on program additions or changes, to say this is how we comply or don't comply with the voluntary national guidelines. That's what they were there for. To start trying to provide education and information. And they were not created by like me at the federal level. They were created by a technical advisory group of states to say, you know, what are the standards? How should we be opening, counting, processing the cases? And there still will be variance, and some of the biggest variance is in the area of financial exploitation. There are states who will not accept a case of financial exploitation unless that person is a fiduciary in some way to the older person. So, and I have a very broad interpretation. It's like the money's gone. You know, if it was the daughter or the neighbor or the guy on the phone, I mean, the money's gone. And I think I would like the state to be able to respond. But one of the ways states make decisions about allocation of resources is decide which of these files complaints are we going to take and which are we not. So that's my kind of Kathy's quick history. In every state, the largest complaint category is self-neglect. Do any of you know that number here? I mean, I did not look at them. I didn't look at the Nebraska number. It's around 40% in both Kansas and Missouri. It's similar in Minnesota, 60% in Texas. That the category of self-neglect is the biggest one. And it's, if you would kind of think about it, when we talk about this, we really should excuse law enforcement from the room. It's not a law enforcement issue, but it's a huge resource drain for states. It's a huge burden to figure out how to respond. And I want to talk a little bit more about self-neglect and can ask you some questions to kind of think about what are we doing, what could we do better. But every state, self-neglect is the biggest complaint. As I continue to do the work and do a lot of national speaking and engage with researchers, there really are different camps even of researchers, of the people who look at elder abuse, the dyad of abuse versus self-neglect. They're different fields from the research perspective. And there's still, the researchers and the academics still do not have an organizing theory, a theoretical framework for elder abuse. They don't know why it happens. And I really think it's important that the researchers keep doing this, but I'm a very pragmatic person. It's like, okay, but what do you want me to do today? Because I got problems today. When I was working at the shelter in Lawrence, I had a friend who did research on domestic violence and sexual assault. We all went up to KU, heard the lecture. She said domestic violence is bad for women's health. It's like, really? Why don't you come down to the shelter? We'll tell you that. You know, so sometimes research is a lagging indicator, not a leading indicator. But we need them to do the work. But they're different fields. And it just kind of depends on kind of which researchers. But a lot of it right now is focused on this dyad, trying to explain and borrow from other theories about why this happens. So what we have now, I'm going to kind of summarize my history, and I'm going to ask you hard questions. What we have now is a National Adult Maltreatment Reporting System, which you should be reporting to. We have some wonderful guidelines from the Department of Justice, the Elder Justice Initiative. They were fabulous partners with us during the Obama administration, have resources online for prosecutors, law enforcement, educators. I mean, now they have designated through the Department of Justice in every U.S. Attorney's office. So somewhere here in Nebraska is someone who's designated from the Department of Justice at the U.S. Attorney's Office as the Elder Justice Coordinator for your state. The Department of Justice has really provided significant training and education, and they've really shown up in a big way. We created a federal home for adult protective services at the Administration for Community Living, so we at least have an official role and ongoing engagement with the states. And the NAMER system has been around long enough now that they're starting to be able to produce some national data. My theory was, going back to Congress, who doesn't want to build something new, is that we're going to need the data to help us with the case. But I'm also not naive about the difference between data and good anecdotal and qualitative evidence. We all know that it takes both. It takes the story and the narrative sometimes to get the attention as well as data. So that's kind of my background and what I've been thinking about. So when I got to Kansas City 3 years ago, thing you should know is I didn't ever work at Adult Protective Services. I took this big charge at the federal level, but I was not responsible for the program as Secretary of Aging in Kansas. It was in our social services agency. I have some degree of guilt because people were like, why don't you move this? They wanted me to, and I was like, nah, I should have. But I didn't run the program at that level. So it's kind of important to know when I tell you this next story. So I started doing work in Kansas City, and I was working with the Bioethics Center, and I had never engaged with the ethics committee of a hospital before in my life. But they had this conference call with an ethics committee from a hospital in the north part of Kansas City. And they were talking about this ethics case, and they were describing this older man whose wife was in poor health. I don't remember the details. And he would bring her to the hospital, and they would get her a little bit better, and then he would take her back home and provide inadequate care. And then he would bring her back to the hospital, and she'd get a little bit better, and so they hotlined her. I didn't know what that meant. I'm so embarrassed. It's like, well, I never worked for they called Adult Protective Services. They hotlined her. I felt it's like, I don't know what you're talking about. It's like, oh, green rookie me. I don't know everything about this. I didn't ever run the program. We hotlined her. And I thought, well, now this is fascinating. You're the clinicians, and someone's requesting inappropriate care. What will those very nice, well-trained social workers in the state capitol do to help that you don't have the ability to do yourself? It was just startling to me that at the hospital, the solution was down the street at the APS office because we hotlined them, and then they were frustrated. It's like, and then what did you do? They hotlined them. So not long after that, I went over to Topeka, and I told a couple of you, I met with a couple of women attorneys that I had known previously, because Kansas is this big, and talked to them at the Kansas Bankers Association about financial exploitation, which is the fastest growing section, relatively. It's like, what are you doing? It's like, we did not oppose being added to the mandated reporting law. It's like, I didn't know what to do. Pat them on the head? I mean, okay. We didn't oppose it. Yeah, okay. So we call. Okay. What else do you do? We call. Do you do public education about lack of capacity, or do you do anything? Because there's some guidance from the federal government now about the ability to freeze transactions. Those are much different in kind of brokerage situations where things move quickly. But there's guidance from the federal government on authorities of banks now to do things when they suspect it. There's the need to do public education. And I said, and then there's the people who don't have someone else but can't manage their money anymore, because the first power to go is your executive function, and they don't put a label on your head when that happens. So you're not going to know necessarily when someone comes in that they really can't manage. They don't do any of that. And those two comments back to back worry me. And what they worry me about is, what signal have we sent about everybody else's responsibility? Because so I won't talk about mandated reporting. I have become concerned about mandated reporting. And as a lawyer, I will tell you, I believe we should prosecute crime. My concern is, are the laws overly broad? If we want the community to do something, we need to help them develop what their standard of care is. So, okay, hospital, this is what we need you to do instead. If the only solution is to call APS, first of all, we'll never have enough people, and we'll never have prevention, because it's already happened. So you all remember this numbers. I mean, 1 in every 10 older adults is abused. And 1 in every 23 cases is reported. Do you have any expectation of getting 24 times more funding for your Adult Protective Services program if we find all these people? No. I worked on a policy in DC that I still very much believed in, but when I got home, I scared myself. It's like, oh, I don't think I thought that through. So I would really like for Medicare to pay for a comprehensive screening for elder abuse. They ask the "Are you safe at home?" question, which is an interpersonal violence question, comes from the CDC, but they don't do elder abuse screening. And in order to get elder abuse screen added to Medicare, you have to get the permission of the U.S. Preventative Services Task Force, which is not a government, it's kind of a private organization. I describe it as this: I'm a woman over 50. They're the ones who confuse me about whether I still need a mammogram. That's the U.S. Preventative Services Task Force. Like, what's the status now of the mammogram? So they have ruled this as incomplete in terms of, is there sufficient data and is there a validated tool to screen for elder abuse for people on Medicare? So it's incomplete. Now there's about 50 million people on Medicare. I'm thinking if we screened, we would find people. It becomes an ethical issue. What do we do with them? And I think that actually gets embedded into some of the task force recommendations. But if 1 in every 10 older adults is abused, and we screened 50 million older adults, are we prepared for all of the United States doctors who are mandated to call Adult Protective Services to call? That's 5 million more calls. We will never have enough back here afterwards. And so I want to talk about what should happen in the community. And I did a longer version of this talk, frankly, in Salt Lake City earlier this year at Park City. I told them we don't have chairlifts downtown here. They have chairlifts into downtown Park City. So I was talking to them at Park City, Utah, about, now see, I've just lost my chain of thought thinking about not skiing in the Midwest. I was talking about screening.
What the community can do.
What the community can do, thank you. So what will be the standard of care in the community? There is a really strong Adult Protective Services director over in Missouri, Catherine Sapp. And I said, would you ask your workers a question for me? Would you ask them what they wish had happened previously? Oh, she said, I'll ask them that. And what they think prevention looks like, because of course those are very similar questions. And I think we need to ask ourselves that. We need to ask our APS workers that, and we really need to talk about, what do you want everybody else to do? What do you want a doctor to do? What should those bankers do? And perhaps you need to mentally do this, set aside the mandated reporting, just to do the exercise, and think, what should they do? Because this is going to become a loop for us pretty quickly. It's like, okay, we need the whole community, all of the healthcare system, all of the social workers, all of the neighbors and church members. We need them to do something. So what we're going to do is we're going to teach them all about elder abuse. We want them to know what it is and how to spot it. And then they're going to call us. Back to mandated reporting. It's like, okay, this is not going to be sufficient. And I think we have to think about, is there a way to triage this? This is why I say, is it overly broad? I mean, are there early warning signs or risk factors, or what could we get to up there, out there, where there was sufficient response? I mean, really? 5 million callers from the nation's doctors to APS? Is okay, no, that's not why I wanted that policy change. I wanted the policy change because I want physicians, internal medicines, geriatricians, who probably are the better ones at this, to say, is this happening to you? Let's do a safety plan. Let's figure out what your risks are, how to create help in the community. The mandated reporting law in Wisconsin is not as broad. It provides a little bit of discretion, and that's what I want to think about. Part of the reason why it's not as broad is that the domestic violence advocates and the disability rights advocates were at the table when they drafted it. Do you think if this movement, which is not really a movement, had started with older people, we would have mandated reporting laws? They are both paternalistic and ageist. And for the lawyers and the rest of you, I think one of the people doing the most interesting writing on mandated reporting is a law professor at Syracuse named Nina Cohn, K-O-H-N. And she's written several articles really challenging this from a civil rights perspective. So you turn 60, this will happen to me in March. The world lines up differently. This is one of the problems with people aging. They think, I feel the same. It's like, yeah, but the world has now aligned differently. Your doctor will have to call. Your minister may have to call. Just because you turn 60. This is not what 60-year-olds probably would have designed. Where does discretion come? And how would we reshape this? And I think Wisconsin did that a little better. Now, I like law enforcement. I think law enforcement is an absolute essential partner in this. But I've not been a law enforcement officer. From my perspective, law enforcement officers would be glad to have just everybody come and we'll sift through where the problems are. You know, I don't know that law enforcement are necessarily the only ones who should frame the conversation about mandated reporting. That it's like, okay, but the rest of us have to do something. We have to find a triage. We have to have a way that we can see it and intervene, and if it's a crime, go prosecute it, but some way to employ the rest of society to help and give them tools. This is where prevention will be. I think we're all kind of stuck on, I don't know what prevention is. I had lunch today with wonderful Nebraska, the Dean, Julie Sebastian at the University of Nebraska Medical School, School of Nursing. She's on a national committee talking about social isolation. Social isolation is a risk factor. Let's screen for social isolation, but don't call it APS, do something. Prioritize transportation, get someone involved, I mean, do the screening. And if we could think about it, and last summer I drew on the board a lot, because I went to a couple universities and said, if you think of this as just sort of a wedge sliding down, at some point there's a trigger. Yep, there's been a constellation of risk factors, we're going to call the hotline. And upstream, risks start to show up. Healthy aging starts to fall apart. People become isolated or frail, or they don't show up for the doctor, things happen. Do we see those things? Can we screen for those things? And if we can't overcome sort of what's the mandate, can we at least start blowing this out? It seems weird to use violent language. Dissecting this and figure out, it's not better, huh? What are the risk factors in here that we should be addressing soon? So let's talk about self-neglect. It's not a very good phrase. And you all know from just like living that if you're using language to describe people that they reject, it's not very helpful, respectful, or appropriate. So which of us as we age are going to sign up for the being in the self-neglect category? This is not affirming language. It's pejorative, it's dismissive, it's prejudicial, it's kind of like non-compliant, it labels people. I think we need a different, I think we have to find something else. People who self-neglect. It also, I think, and I worry, connotes an intentionality that may or may not exist. It's like, I want to live with the rats. No, I mean, they may want to still live there. But I think self-neglect we really need to question. I'm struggling with what might be better. I think failure to thrive is a tad bit better. It certainly plays into kind of a general public sense of what that might be. I was talking to Terry Fulmer, who's the head of the Johnny Hartford Foundation, a couple weeks ago, who's a nurse who's been doing this work for a long time. She said, I think it's inadequate care. People who are receiving inadequate health care or behavioral health care. And I think we need to look at this population and pull them out and educate ourselves on who's in that bucket and see them specifically. Because I think that this is a healthcare crisis. And that's why I said we should have law enforcement leave the room, and we got to invite all the health insurance people in. This is a health insurance and a healthcare crisis, physical and behavioral health, in the self-neglect category. It's where most of your cases are. Not the majority, but the biggest cohort is in the self-neglect category. So here's another third rail kind of question, right after mandated reporting, and that's confidentiality. Ooh, that's all made me bigger. So I understand why, I'm a lawyer, I understand why it exists. In this group of people, we're not worried about protecting the identity of an alleged perpetrator. There are not due process issues in this group of people for an alleged perpetrator. It is the identity of the reporter and the identity of the person that we've opened a case on. That confidentiality. What interests are served by that? And are they helpful to the person or harmful to the person? And if all the doctors in Nebraska call Adult Protective Services, and a third of those people are open files for Adult Protective Services, cases of self-neglect, can you tell your Medicaid agency? APS is government, Medicaid is government. If you want the doctors to help, who tells them we've got an open case? So I have a friend who is way high up there in Anthem Insurance, and she's heard me talk about this, and finally she said, I finally understand what you're talking about. I said, what could you do to provide help? Because APS is not sufficiently funded. I said, okay, Anthem, if you knew that some of your beneficiaries were over in the Nebraska self-neglect file, what could you do if you knew they were there? Could you do capacity evaluations, emergency transport? Could you provide meals on a temporary basis? In Johnson County, Kansas, the city I live in, the county I live in January, they arrested 3 different alleged perpetrators, moved them out of the home, and these people were caring for an elder who needed care. Like, Anthem, we've taken the son out of the home and the mom needs care. What can you do for an emergency respite care until we find something? There's all of these other people that we need to invite into the conversation, and we will need to lead the conversation about what we're comfortable with and what older people would be comfortable with. And one way, sort of through this maze with regard to confidentiality, is just to get permission. Should we try some things? Should you find a funder? Should we hit someone up and say, let's try some things? Let's take 100 of the people, let's get consent, and let's see what we can do. I had the opportunity last fall to work on the transition team for the new governor in Kansas. And I was assigned to my former agency. So it was like a little reunion. It was fun to be back. I didn't want to keep working there though. So I went back. And in Kansas, the agency that investigates Adult Protective Services is on one end of the block, and the Department on Aging is on the other end of the block, and they have the Medicaid waiver programs. So I would go talk to the APS people, and they would go. And then I would go down and talk to the waiver people, and they say, we don't know who any of these people are. So get together and say, what would we try? And what would be the goals? And if we looked at this as a healthcare issue, what could we actually start providing? And it would be interesting then for the legal brains to say, could you create an MOU within the government structure to share? So not public, we're going to share it with Medicaid and then figure out what we do. So these 2 issues, confidentiality and mandated reporting, are kind of sacrosanct in this work. But I think we need to think about what we're getting from them, what they're conveying, and what the ways in which they're limiting us. I did a talk at a medical ethics conference in Wichita in March, and I had a Nebraska minister come see me. She said, I'm a mandated reporter, and I called, and there wasn't anything they could do. She was so disappointed. She needed to provide pastoral care. We need to provide education to her, but the solutions are not always going to be found over there in APS. Do you all have any reaction or feedback? I want to talk about what's going on here in the Midwest. Thoughts, things you've thought of before, scaring you to death? You're mostly not asleep, so we're almost at the end of the day. But do you have thoughts or questions? Yeah.
I think it's interesting that we come into this world, we can't talk, we can't walk, you know, we poop our pants, we do all these things, and it's really cute. And then you get away from that, and you're pretty self-sufficient, and then you go down, and it just isn't real cute on the other side. And when you said, you know, that this self-neglect is pejorative, you wouldn't say that about a baby.
No.
You know, why do they self-neglect? Well, they don't self-neglect. They can't take care
I see
of
them as
themselves.
people who are unable or unwilling to overcome the circumstances that we think are so bad for them. It may be bad for them, yes. Yeah, and it's a dismissive kind of.
It's like punishment for hanging around.
And these individuals can be really challenging.
Sure.
And if you talk to the APS workers, I mean, these are not like who you want to go have lunch with.
Exactly.
I mean, I'm not a Pollyanna in terms of the characteristics and profile and the complexity in this population. But they, I think, are humans deserving of help, and the labels could get in the way. What do they need, and how else do we find more people? The National Adult Protective Services Conference, so the big APS conference, is in Denver this week. And I gave the keynote last year, and I told them about an experience I had, because since I never worked APS, I did a few home visits last year with Adult Protective Services out of Kansas City, Missouri. And we went to this woman's home who was a hoarder. She was a self-neglect case. She had no running water, no utilities. Her house looked like you would think. She lived in the front, in the recliner. We sat on rickety chairs in the porch because there wasn't any way to get into the house. And she didn't want to move, you know, and I kept thinking, with my legal hat on, I don't know what I would do if I was her guardian. I don't know that we offer anything better, as deplorable as this is. I don't know what we provide her. She was 87, and she didn't want to move. She had family, it was remote. So I kept thinking kind of from the legal hat, I was like, I don't know what I would do. I really don't. She needs help, she has to get outside the yard and flag someone down. And then I kept wondering, what did we miss a decade ago? Where was this woman a decade ago? When was she considered non-compliant because she didn't come to a doctor's appointment? And where was the sort of the community response to get into the home and see? They're very complicated, and she was tough. She was tough. And she was probably one of the easier cases that I know that Adult Protective Services workers see. But I asked her, her name was Mary, I said, what gives you hope? And she didn't answer. Oh, the two friends I was with, the two APS workers, they loved this question, so they asked it to her later, what gives you hope? Have you all heard me tell this story? Because I don't know if you were, what gives you hope? So they asked her and she didn't answer. Now, a few minutes later, she said, I do have a dream. Promise you won't laugh. Well, there's no way we were gonna laugh at this point. What is your dream? She said, I want to have a slumber party. She said, I want to have women my age over to spend the night. I want to have a house that's nice enough that I could have them over. I want to play cards, and I want to bake, because I'm a really good cook. And I tell this story because I think this kind of perspective or view of an old lady slumber party is one of the saddest stories I've ever heard. She knew what she valued and what she wanted, and here she was in these deplorable conditions as a self-neglecter. And you know what? When I'm 87, I want to have an old lady slumber party. I mean, this was such a normal, reasonable thing to do. Friends and food and cards and just the things that we all value, she still valued. So how do we see this sooner and really start to look differently about who we're serving there? And I am not naive about the complexity. So I told you that when I moved to Kansas City, I started calling around. I'd never lived in Kansas City before. There are some things about Kansas City I find to be odd. The state line. Now, I've shopped and eaten barbecue over Missouri. I didn't know anything about it. I mean, I was a Kansas official. And what that does to that community is really amazing, because I wanted to find out who is everybody here who's working on elder abuse. And I figured, unfortunately, I could find them all. And I did. So there is a task force at Mid-America Regional Council, so where the Area Agency on Aging is, Kansas City, Missouri. There's an elder abuse task force. There's a small multidisciplinary team across the river, you can see them, in Kansas City, Kansas, that's run by the Area Agency on Aging. It's kind of small. The county I live in Johnson County, the DA is really good. They have a FAST team, a financial abuse specialty team. There's a community anti-violence project that has an elder abuse subcommittee. So those are three. And then the U.S. Attorney's Office in Kansas City, Kansas has a task force. They don't all know each other. I introduced the Kansas City, I'm so proud, the Kansas City, Kansas and the Kansas City, Missouri APS directors to each other in January. And it's like, oh, hey, this is really sad, and this is one issue. So it's like, okay, we really need to get together collectively. So I started finding out what's happening here, and then I called Cynthia and said, what's happening in Nebraska? That's how I found out you had a coalition. And I want to know what's happening in the Midwest. In Minnesota, there is a strong Elder Justice Center. They used to have a couple of statewide initiatives that came together. I think they were at 2 different law schools and they merged, and they have a pretty robust Elder Justice Center where they provide technical assistance, training, training to prosecutors, private attorneys. And talking to them, they said they knew when they set it up, they would get calls for individual representation. So they have staff attorneys who can provide assistance as well. In Iowa, Bob Wallace at the University of Iowa in the School of Public Health is one of the early researchers in the nation on the issue of elder abuse, in particular on self-neglect. He doesn't like that word either. He just calls it neglect. So, well, we can do that. It's not a positive word, but it's not quite as blaming. And so Bob is over in Iowa, and they have a, I don't know if they have a statewide coalition. Do any of you? No, I don't know. I've talked to their APS workers. In Missouri, they have a really strong adult protective services program. Their efforts are really led statewide by their Secretary of State, because he has the security commissioner's responsibilities within his state, Jay Ashcroft, his son. And he has taken a big role, and there's a Missouri Prosecutors Association that's been active. In Missouri, they would really like to be able to establish multidisciplinary teams. Are you all familiar with MDTs? Where it's just very self-explanatory. You bring together different professionals and you do case review. It's like a death review group, except the person's alive. It's like, let's do it then. And they bring the experts together, and part of the challenge in doing a multidisciplinary team is that you need the statute to be supportive enough that you can get beyond the law enforcement and government people at the table. You'll need a clinical person, a geriatrician, a psychiatrist. I mean, you're going to need some clinical people to really be able to look at complicated and tough cases. So Missouri's changed their law so that they can now start setting up multidisciplinary teams. In Kansas, we don't have a coalition. Is that what they do in Nebraska? We don't have a coalition. We do have an Attorney General, Derek Schmidt, who just finished his term as the president. It's a revolving 1 year at a time president of the National Association of Attorneys General, NAG. And he highlighted elder abuse during his term as the president of NAG. And what he has done in Kansas is made sure that the Attorney General's office can provide backup support or primary prosecution in counties when they need to prosecute elder abuse cases and they don't have the technical expertise or the bandwidth. So he's taken a big lead. There's a woman at the Oklahoma Bankers Association who has done so much. We invited her to DC and had her speak at a White House gathering we did 7 years ago. They have strong triad system in Oklahoma. I don't think you have them here. I found one sort of like, it looked like a plant that hadn't been watered down in Wichita, and they've kind of reconstituted it. But triad is a multidisciplinary community-based effort that started with the National Sheriff's Association. And it's a community response that really provides services and connections between law enforcement and community. Think of it a little bit as like the community policing version of working on elder abuse issue. That's something that you all could do here. I mean, there are other places around the Midwest where they're doing more work in terms of MDTs. Georgia Ansenberger. Do we think Ohio is in the Midwest category? Because, you know, I'm always kind of like, yeah. Georgia Ansenberger in Ohio is one of the leading researchers in the nation on elder abuse out of Ohio. And it's like, well, if you're going to put the Great Lakes together, they'll go there. If not, we'll take them. There are things happening here, but we're not on the map. The first year I was home, as we got ready to lead up to June 15th, World Elder Abuse Awareness Day, I became obsessed about the national map that they keep online at the National Center on Elder Abuse, because I turned it purple for all of the activities, and I knew we were doing things, and we weren't getting credit for it. That the nation was overlooking what was happening here, and I knew we were doing things. If you're doing things June 15th, you have to get on the map. And then, how do we all get together? What are the things that we do really well? There's do you all know Paul Greenwood? He's a very well-known prosecutor out of San Diego.
He's been here.
He's awesome. Paul's been here. He's awesome. And when I was in San Diego many years ago, I asked him if I could meet with some victims, because one of the problems with the big federal job is you don't see real people very much. And it's like, I want to talk to some victims, get some stories, and he convened them. So I have nothing negative to say about Paul. He's wonderful. He is not the only fabulous prosecutor. He's on the circuit. And so at the national level, there are people who have the resources. He's retired now, he's written a protocol, he's on the circuit. I can tell you a few other prosecutors around the country who are out there on the circuit. They're very well known because they're in communities where there's enough resources they can be out there at all the presentations. The woman in my county is as good as the rest of them. There are prosecutors in Nebraska as good as Paul, you know, and yet we're not looked to or seen. A couple years ago, I got a call. So I've been in Kansas City about a year. I got a call from a colleague of mine at the Department of Justice and said, we want to put on a rural elder abuse event convening. And really, I've done national work. I said, don't come to Kansas. I didn't call Kansas and tell them, but Kansas is not really strong. I said Iowa's stronger. And they wanted to go someplace where they had one of those U.S. Attorney task forces, so they came to Iowa. Did any of you go? Do you know at all? I'm talking about it. I said, about a year and a half ago or so. And they put together an event on rural elder abuse. And my advice to Andy was, if you're coming to the Midwest to talk about this, you must have faculty from here. Do not bring the people from the coasts to the middle of the country and not highlight what we're doing. We have people here, and we have to figure out how we can start seeing ourselves in the middle of the country as a cohort or a coalition or something to say, we have a presence. We really should own this issue of elder abuse in rural areas. I was telling Margaret, wasn't it, that phone call I got from that laughed at being back in Kansas because, you know, it's this big. So I was in Topeka, I was in Kansas City, and I wanted to talk to an attorney I'd heard about who's on the Oklahoma-Kansas line. And I'd never met her before, saying, Ruth, I heard she's been doing elder abuse for 20 years. So I sent an email to Topeka, to someone in the AG's office. It's like, I want to get a hold of Ruth and find out about prosecuting elder abuse on the Oklahoma-Kansas line. Ruth called me 10 minutes later, just made me laugh. It's like, oh, I've come home. The email went to Topeka, completely down to Oklahoma. I got a call 10 minutes later. And I was just laughing. I was like, yes, things can happen quickly here because it's not that big. We can network here. And I was sorry that I'd never met her before, but I talked to her about what are the challenges you have prosecuting where you prosecute. She said, I have no services to offer. We've got a five-county mental health coalition here that's pretty strong, but they're under-resourced. You know, these struggles that we have in providing services in rural areas, we should know about. We should find people in the Midwest to research. When I was talking to the dean at lunch, I talked to her about prevalence. Have you ever done a prevalence study here? We don't have a prevalence study in Kansas. So when I talk about 1 in every 10, I use national data. The 1 in 10 number comes from the National Elder Mistreatment Study. Rhonda Chernow was the researcher, but we don't have prevalence. And Dean Julie was asking me at lunch, she says, elder abuse worse, you think, in rural areas? I was like, I don't know. She's on a committee, and the reason why I reached out to her, she's working on social isolation, and there's research that says in rural communities, older people have more social connections than older people in urban areas. And social connections are a protective factor. So is elder abuse the same? Is the prevalence the same? What are the issues? We need to be the ones here doing this somehow. And I wanted to meet you. I wanted to come cheer for you and cheerlead and say, you have a coalition. This is the 9th year you've been doing this. You know what you're doing. You're still awake at the end of the day. You're committed to doing this. It's hard work. But I'm kind of tired in every way of the stereotypes of flyover country. I know what it's like to be from here and live in the East. And you know, like some of these stereotypes are based in some reality. Meeting people who don't know anything about anybody west of the Mississippi. And here we are, doing the work. And how do we at some point own the space? So you're coming to Iowa? Here's Bob Wallace from Iowa. He did the research 30 years ago. He should be here. And anything we could do in any of your national associations, any way, I want you to know, I didn't bring slides, so you can find me. I can give you contact information. Anything I can do to help promote us in the Midwest, I want to do. Any way that I can help you, any way I can connect you. I have had the extraordinary opportunity of meeting the leaders in this work around the country and a few in Europe, and the researchers who are doing this work. And if there's anything that I can do to help promote, or let's apply for some money. Who would fund a prevalence study here? Let's go talk to the Nebraska Health Foundation. Let's start opening people's eyes to what aging is and what these healthcare issues are. Let's be strategic. This is my favorite thing to do, and it's really, really wacky nerdy. But I think budget strategy is just a blast. I mean, how are we going to get the money to do it? I did. I go talk to those members of Congress and their staff and say, you can't just say you're not going to build it for older people. That's not acceptable. The last advice I would give you, and I really want to do some Q&A, is will you please make sure that all of the policymakers who can touch this know about it? And that's the county level, the state level, your members of Congress, and that they hear about it if they can from their older constituents. That what you need from your federal and state officials, people like me, is you need me to validate what you're saying. You need me to go to the Capitol to talk to a member of Congress and staff and say, we do not have sufficient services for respite for elder abuse victims in Nebraska. And have your Nebraska members of Congress said, you know, I heard that at home. That they will only believe me if they have heard it from you. It is not effective advocacy if I'm the one to say, you know, you don't have enough money for Meals on Wheels, you don't have enough nutrition. I can't be the one. I'm the second. And your job at some point is to get this information to them. And I think one of the hard parts of doing this, and this is grassroots advocacy, is to encourage older people, and I think this is the hardest thing to ask, frankly, older people to do, is to tell people how they're struggling. I mean, I'm a proud Midwesterner. It's like, okay, you're caring for your spouse at home. It's wearing you out and killing you. Does anybody know? Because when I come say we need more money, they need to see your face, not mine. And the best that you can do here is to continue to work in the coalition that you have and bring those voices into the room. They are the ones that are most salient, and keep at it, because you've been at this for a while. You've got 350 people that I wish could drive down and meet me in the lobby when we're done doing the work. And I will be your champion. I'm like down in Kansas City. I'm going to drive back tonight and say, you know, it's not all about Boston. I'm working on a project that the Johnny Hartford Foundation has funded to try to develop a screening tool for elder abuse for use in emergency departments. And one of the researchers and the team come from Massachusetts, and they always talk about going out to rural western Massachusetts. Okay, well, it's not the most remote place around. There's rural places in 70% of the country is rural, so there are rural places everywhere. But there are differences in remoteness that we understand here with this big sky, and differences with regard to poverty. They have more resources in Massachusetts at the state level, I promise you, than either of our states, any of our states here. So we have a unique role and a unique voice and some special things that we could add, and we actually know what rural means. And I think that that's valuable. There's people who know, there's people who don't, and there's people who don't think they do, but don't. I mean, there's just people who think they know more than they do, and we should be the leaders. Do you have any other comments or questions for me? I'm getting my nice 2-minute sign, and then I will drive back down Highway 229, past your flooded fields. No, we've had, yeah, it's been the same thing there. Anything? Will you call me if there's anything that I can do? I know an amazing number of people working on this, and let's hit them up to help. So thank you all for your attention.
Well, thank you all very much for attending our 9th Elder Justice Training. Don't forget your evaluations and get them into the state unit. Thank you.